There are many different types of medications that are currently being used for migraines. Some of them can be used every day to help with a preventative measure, and other medications we use when those migraine auras or you start getting that feeling of the migraine coming on, then we use them acutely. Many of that classification of medication can only be used in relatively small doses for short periods of time. In other words, you can use it once or twice a day for maybe 3 days at the most. And there's a wide variety of side effects that we have to be careful of, because not only do they help with the migraine, but they can affect other areas of the body that can be seriously impacted, such as cardiovascular health. So we just have to be very, very careful with them. Some of the other medications that we use for preventative measures of migraine may be everything from what we would normally use for blood pressure, or medications that we use for other parts of heart disease. Sometimes we even use some of the older antidepressants to help alleviate that incidence of migraine. Some migraines are cyclical, right? So they happen at very specific times of either a woman's cycle or following very specific events. What's wonderful about compounding is that a lot of times we can make a medication that is going to be specific to what your needs are. And many times we can combine them. So with migraine, some of the symptoms that first happen is people just kind of feel heavy. They feel kind of like their head's being pushed down. They might have some nausea, maybe even some vomiting. They're not even able to keep down simple fluids. So when we compound medications, we can put them in a device where the medication can be delivered through the skin. So it can be delivered transdermally. We can use anti-nausea medications, but then we can use other medications that work specifically to target the area where the headache is. So individualizing these medications to what your needs are, that's where we're going to see the best outcomes. Especially when, a lot of times when I talk to headache sufferers, they haven't been suffering for just a few months. This is usually decades-long issues. So let's get to the root of it. Let's help fix your issues. Let's help treat what's going on with you, so that you can feel healthier from here on out.